What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani. Today's episode is brought to you by Thrive Therapeutics 5-in-1 calming gummies for kids as well as adults. We're huge fans. My kids love it. I highly recommend you try it out. As promised in earlier episodes, I want to go into CBTI, cognitive behavioral therapy for insomnia. So if you are one that is struggling with insomnia, if you have patients, if you have family members that are struggling with insomnia, CBTI can help. Now, we know that sleep is essential for our well-being, right? Mental, physical, emotional. And yet more people struggle with insomnia, a sleep disorder that disrupts our ability to fall asleep or stay asleep throughout the night. Insomnia, we know, can have a profound impact on our daily life. It can lead to fatigue. It can lead to decreased productivity and negative health consequences, including a greater risk of dementia. We know that. In our previous episode, I talked about patients that are looking into sleeping pills and sleeping aids as a go-to solution. But we know that while medications often seem enticing, they can have side effects. They can result in dependency, which is why I'm a huge fan of CBTI, cognitive behavioral therapy. It is side effect free, highly effective, and a lasting treatment option for anybody that may be struggling with insomnia. So let's touch upon what insomnia is. Insomnia is difficulty falling asleep or staying asleep, or experiencing non-restorative sleep despite having ample opportunity, which means you're in bed for 8, 9, 10 hours and just can't get to that sleep where you feel like you actually are rested. Now, insomnia can be short-term or acute, if something's going on with life, or it could be long-lasting and chronic. It could stem from various causes: stress, anxiety, life changes, medical conditions, lifestyle factors too. The problem with treating insomnia with medication is medications can be effective for the short term, don't get me wrong, but they often come with drawbacks such as dependency, tolerance, right? You need higher doses for the same effect, and also side effects such as drowsiness or impaired cognitive function during the day. And we also know that medication alone does not address the root causes of insomnia. It's a Band-Aid. It is a temporary fix rather than a long-term solution. CBTI, which is cognitive behavioral therapy for insomnia, is considered one of the most effective treatments for chronic insomnia, and it is typically delivered by a trained therapist. It works by addressing the cognitive as well as behavioral factors that contribute to insomnia, and it teaches people healthier sleep habits. So unlike medication, which is a Band-Aid, CBTI aims to give us the tools and the skills that we need to improve sleep naturally and sustainably long-term. What are the steps? How does CBTI work? The first step is always assessment with a healthcare professional or a therapist, somebody that's trained in this. And this assessment identifies the specific factors that are contributing to the insomnia. And then we tailor the treatment plan to this patient's individual needs. The next step is psychoeducation, where patients are educated about sleep, about insomnia. This could include common misconceptions and beliefs that may actually be making their sleep problems worse. So understanding the principles of CBTI can help patients develop realistic expectations about their sleep. A key component of CBTI is sleep restriction. Now, this involves limiting the amount of time that is spent in bed to just the actual amount of time that is spent asleep. So it's like I tell patients, if you get into bed and you have a hard time falling asleep, get out of bed. Don't lay in bed hoping you're going to fall asleep. And then the next thing you know is out comes the phone, and then you're watching Netflix and scrolling on Facebook and TikTok and all the other things, or texting family members. So initially, this may mean that you're spending less time in bed than desired just because you want to increase sleep efficiency. So limit the amount of time that you're spending in bed to just when you are asleep. Stimulus control is another key step in CBTI. Now, this technique helps people reassociate the bed and the bedroom with sleep rather than wakefulness. So it involves guidelines like using the bed only for sleep and sex, leaving the bedroom if you're unable to fall asleep after a certain period of time. We've talked about this. No eating in bed, like no watching TV in bed. If you're going to read, get out of bed, get to the couch or your favorite armchair, those kind of things. You want to associate that bed with sleep rather than wakefulness. Patients are then educated about creating that sleep conducive environment and developing good sleep habits. This includes maintaining a regular sleep schedule, avoiding caffeine, avoiding alcohol close to bedtime, reducing screen time before sleep. And then comes cognitive restructuring. This aspect of CBTI addresses negative thoughts and worries about sleep. Patients learn to challenge, reframe, restructure these thoughts, which then in turn reduces the anxiety and frustration that can contribute to insomnia. We also go into relaxation techniques such as progressive muscle relaxation, deep breathing. All of this can help reduce anxiety and tension that interferes with sleep. Starting to develop a relaxing bedtime routine. That is what will signal the body that it's time to start to wind down, get ready for sleep. As part of CBTI, patients are given specific tasks or homework, as I call it, to practice in between sessions. This could include keeping a sleep diary, following your sleep restriction guidelines that we may have discussed, or practicing relaxation techniques. Now, once these sleep patterns for a patient starts to improve, then the therapist helps them to maintain these changes over the long term. And then this obviously will include periodic check-ins, follow-up sessions, and as needed. Now, CBTI is typically delivered over several weeks with regular sessions to monitor progress and then to make adjustments to the treatment plan as needed. So important for us to remember and to understand that CBTI is a non-pharmacological treatment for insomnia. This does not include sleeping pills. Sometimes, in some cases, it can be used in combination with medication under the guidance of a healthcare professional. So important to remember this. Now, the benefits are huge. CBTI is very effective at treating insomnia. Several advantages over medications. Long-term success. Medication we've discussed is a Band-Aid, right? It only provides temporary relief. This CBTI, long-lasting benefits. Many patients who undergo CBTI report they have improved sleep patterns, which tend to continue way after treatment has ended too. There's minimal side effects, right? It's medication-free, except for those rare cases. Which means there's no risk of dependence, there's no risk of tolerance, there's no side effects that are associated with these sleep medications. CBTI also dives into the psychological and behavioral factors that are contributing to insomnia for these patients. It helps people understand and address the root causes of their sleep issues. There's better daytime functioning, better sleep quality, improved daytime alertness, better cognitive function, overall well-being. And another key thing that makes it huge in my book is it's personalized. It is tailored to each person's unique challenges, unique sleep challenges, unique sleep patterns, and it's personalized and it's effective. And we know that insomnia is common. We know that it's frustrating. Yes, it's a sleep disorder, but it does not have to be a lifelong struggle. For patients that use CBTI therapy for insomnia, this is a holistic and a sustainable solution for getting a better night's rest. By addressing the psychological, by addressing the behavioral aspects of sleep, we are empowering patients to take control of their sleep patterns. That way, they have more restful nights, more productive days, and just an overall better quality of life. I know you know somebody that could benefit from this information. I know you have someone in your life that you love very much that is struggling with insomnia, with poor quality sleep. Share this episode with them. See if this is an option for them, a long-term solution versus Band-Aids. Leave us a review. I will see you next time.